Welcome to Now Innovating, a research to impact series at the University of Calgary. I'm your host, Julia McGregor. It's a new year and a new cohort of teams with the Academic Entrepreneurs and Residents Program, or AIR. The AIR program at the University of Calgary supports faculty, staff, postdocs, and students who have developed research ideas with mentorship and practical support to create a plan that moves them further along the innovation continuum and toward impactful solutions in the community. This episode, I speak with Dr. Bousman, who is part of the first AIR cohort. He's an associate professor in the Cumming School of Medicine with appointments in the departments of medical genetics, psychiatry, physiology and pharmacology, and community health sciences. His research and expertise in pharmacogenomics, an area of precision medicine, has led him to develop Sequence2Script. Sequence2Script is a free online tool for healthcare providers and laboratory services to translate pharmacogenetic data into clinical recommendations for the prescription of medications. Hello, Chad. Welcome to Now Innovating. Happy to have you.
Yeah, thank you.
I'm really excited to just get to learn more about you and your research. So, and you do conduct research in a lot of different areas. So you got genomics, mental illness, pharmacotherapy, pharmacogenomics. That's quite an impressive set there. But we're going to focus on the pharmacogenomics today. I was hoping you could just let our audience know really what that is and like how that relates to precision medicine, or if they're unfamiliar with what actually precision medicine is. I'd love to learn more.
Sure. Pharmacogenomics is basically the study of how genes and drugs interact. And by understanding that interaction, we can use a person's genetic information to predict how well they'll process or react to a medication, such as antidepressant or pain medication. And the ultimate goal is, of course, to reduce the amount of trial and error that goes into prescribing and get people well sooner.
So that's the personalization of personalized medicine there.
Exactly.
Sure. Very cool. And then your specific research in this area, is that what you're looking at there, or do you have a different research question?
We have a number of ongoing research projects. I think right now our flagship project is called PGX-Spark, which stands for Pharmacogenomic Supported Prescribing in Kids. And so this is a project that's going into its third year. It's funded by the Alberta Children's Hospital Foundation and the donors there. It's been a really great kind of more community project, really. So basically what we're doing is we're recruiting kids that are starting or changing a psychiatric medication. Okay. And we do the testing, the pharmacogenetic testing. So basically they spit in a little tube, which they tend to like. They get to spit, spitting for science.
Allowed to spit, yeah.
Allowed to spit. And we take that spit, we extract the DNA from it, we do the pharmacogenetic testing, and then we provide using that genetic information, we provide a report to their physician to assist them with prescribing medications. And then we're following each participant for 6 months, and then we get permission to look 6 months prior to them starting using administrative data, and basically to see, is it making any change? And so the main objective of the study is to implement and evaluate Canada's first pharmacogenomic testing service for mental health for kids.
Amazing.
Yeah, and we just, actually excitingly, we just focused on Alberta at the beginning, but in the last 3 months we've now expanded to all Western Canada. So now we're recruiting in BC, Manitoba, and Saskatchewan.
What's your participant goal for that?
Well, when we got funded, this is pre-COVID,
okay.
We were shooting for 6,000, very ambitious. Yeah. So right now I'd be happy if we got half of that. We've had to kind of pivot because we were going to do in-person recruitment. We couldn't do that during COVID. Right. So we switched to mailing out the kits to people's houses. And even though now we could do in-person, people like to get it in their own home, do the testing. Yeah. So we've kind of kept that. But it is extra cost.
Right.
So with extra cost, we have to cut down our goals. But we have over 700 now. So we're doing really well, and we get really good feedback about the project. Yeah.
Well, and I'm sure that study is also on the Participate in Research website for the University of Calgary. So if people are interested, they could, if they've got children at home that are looking to participate.
Absolutely.
Great. So that project alone sounds amazing, and you're obviously doing a lot of research. So how did that lead you to develop, Sequence2Script?
Yeah, so without Sequence2Script, actually, PGX-Spark probably wouldn't be as effective. It may not even come to be. So Sequence2Script really came out of meeting a local need. So when I arrived in Calgary just a bit over 5 years ago, the first thing I did is basically an informal environmental scan to see what are the hurdles that we currently have now to getting pharmacogenetics into practice. And one of the things I identified right off the bat was we have really good genomic services, so we can generate genetic data, no problem. I'd say we have world-class ability to do that. And we have great physicians that really want this innovation, but we had a bottleneck. How do we get the genetic information to physicians in a form that they can understand and use it quickly? They don't have to dig into the literature and do that. And so this is where Sequence2Script came in. We needed a tool to do that translation. Take genetic information from the lab and put it into a report that healthcare providers can understand. And that's what Sequence2Script essentially does.
That's amazing.
Yeah.
Oh my gosh, how did you even develop that tool?
Yeah, so it is based on evidence.
Yeah.
So there's a lot of pharmacogenomic guidelines. So the guidelines are basically set up as if you have this genetic information, this is how you could use it. So the guidelines don't tell us when we should test or how we should test, but it says if the information is available, this is how you can apply it to your patient. So we took all those guidelines and put them into one database. And then we basically matched that to all the genetic information, and then we created, a report that was appealing, and did a lot of iterations of, do you like this one? Do you like that one? And talking to physicians, talking to the lab techs.
User testing.
Lots of user testing and user design. In nauseam, a number of designs, but in the end, it really came out to be nice, and we're still doing it. Yeah. It's a never-ending process, really, tweaking here and there. But yeah, that's kind of how it all began, and it started with NeuroNexus.
Oh yes.
Yeah, so that's how it really took flight, I guess. It was until then it was just thought in my mind floating around, but that really is what brought it all together. Getting really talented students from like the user design space, software engineering, and bringing everyone together and basically helped me do what I couldn't do on my own and get a prototype. And then, I guess, as they say, the rest is history.
Yeah, and what year was NeuroNexus that you started this in?
That was 2017, 18,
okay.
Maybe. I can't remember which year exactly.
Yeah, it's all blurred together now.
Yeah, but it was certainly before the COVID pandemic. Yeah, and then, that was really the turning point of it all.
Amazing. So, I want to ask you about, switching from, being, a scientist, doing just research, to, taking this entrepreneurial path. I know it's kind of, there's a free to access portion of Sequence2Script, but I know there's also like a subscription model, like, getting your head around like setting that up and like how are you processing payments and how are you making sure people know this is here. So I'm just curious, like, what are the steps you took to like being like, just switch your brain to that other course?
Yeah. It didn't happen overnight.
No. What?
No, it definitely didn't happen overnight. So when we first developed it through the NeuroNexus, it was just going to be a free tool. That's always what was in my mind. Like, I just want to make sure that this tool is available to everyone. Was just mainly developed for a local need here, like I mentioned. But then I started presenting like our experiences here at conferences and with colleagues, and then they would come up to me afterwards and say, "Hey, can we get access to that?" And that's when the light bulb turned on. Like, oh, maybe we should make this more broadly available. And so we made at first just a website that was free, kind of point and click and do stuff. But then I started getting more requests about, well, can we do this in batches? Like we have, hundreds of that we run at a time, or 50 at a time. Doing each one point and click is just not feasible for us. And we already had a batch that we used internally here, but we weren't making it free.
Yeah.
So that's where the subscription came in. Like, all right, well, we can make some of these other features available to others, and we'll charge for that. And when we started that, then it just started snowballing. Really kind of, I would say, effortlessly at first, because I didn't realize how many people had the same bottleneck as we did here. Retrospective, I would be like, yeah, of course other people had it, but I just assumed other people figured it out or created something themselves.
Yeah.
But most didn't want to create something themselves. So they were happy to pay us to do it for them.
Well, it's almost like a great knowledge translation activity too, of like getting it out there, because if it's going to help other clinicians and researchers and like understanding their data that they have, like that's really cool. Oh my gosh. Well, I know I'm tying this episode really into the academic entrepreneurs and residents program, which I know you're part of. You're in the first cohort. I'm just really curious, like how that program has supported you. What's it been like?
Yeah, I've taken part in a number of the programs. There's also one called Spark.
Yes.
So I'm just finishing that now, and kind of there's some overlap with AIR.
Yeah.
So I've really taken part of a lot of the Calgary innovations kind of ecosystem. But AIR specifically, I would say, has been invaluable to me because I think they're academics. First, they were academics as well, and also obviously entrepreneurs. They understand, I think, really well like many of us academics have a conservative mindset around entrepreneurship to the point like almost fear of it in some ways. Not everybody, but I certainly was like, that's not for me, right? I'm not a business person. I'm an academic. And they really kind of have helped push me out of that comfort zone and challenge me when I needed to be challenged, and I appreciated that. And certainly my mind has flipped quite a bit. And has pushed me along that entrepreneurship path because of it.
Excellent.
And I don't want to stop meeting with them. I think it's been really good. I know at some point all good things have to come to an end.
They're like, go on, Chad, you're fine now. Yeah. You don't need our mentorship anymore.
I've really enjoyed the discussions we have. Yeah. They're very organic. It's not like formulaic at all. It's just like what's going on today or this week, and we just go through it. And it's been really great. I always leave that meeting feeling a bit more with a jump in my step, so it's always good.
Excellent. Well, I'm really glad that's part of the Innovation UCalgary ecosystem, as well as Spark Calgary, and shout out to W21C because I used to work for W21C. So
it's been great. Cool. The I can't say enough about just the ecosystem in general. In some ways, there's almost too much that I don't know, like
where do I start?
But they even help with that too, like they really have different things along the whole spectrum. It's really a good place to be if you're an academic in academia and want to get into entrepreneurism.
Very cool. So my next question is more kind of like, I think you've kind of talked a little about you're getting people coming to your conferences like saying, I need this tool, and you knew it was a local need. And like, I know Canadian healthcare systems alone, like Alberta, one procurement system, it's all different across Canada. You're not really sure how to get into different hospitals or like get adoption of tools. I'm just really curious, like how you did find your market, and like how did you what were challenges you faced and you overcame in that and getting, your tool in use and picked up?
I was a bit fortunate in some ways that, at least at first, the market came to me because, like I said, I was going out there and talking, and then because of the genotyping system that we use here in Alberta, that company heard about our tool and knew that we'd optimized it to their system. So they actually started putting Sequence2Script into their slide decks and saying, hey, others that are buying our system may be interested in this tool. And of course, didn't stop them from doing that. I was like, yes, please tell them. And so I started just getting cold calls opposite to me saying, hey, I hear you have a tool. This company told us about it. Can you tell us more? And so it's been really, an interesting way of getting customers. Now, it's slowing down at point. So, we have to go, do other things. But that first initial, which is usually the most difficult part, so I'm told, was actually less of an effort than it is now. We're kind of hitting that middle ground where now it's about awareness. People can't adopt what they don't know about. So we have to get out there and kind of focusing more on marketing and how do we let people know that this tool exists, and then how it can help them. And then the second bit there, because you mentioned the Canadian kind of marketplace, in particular in this, in pharmacogenomics, it's a challenge here in Canada because right now there's no province that covers pharmacogenetic testing. So it's all out of pocket. There are some insurance companies that do cover it a little bit, but it's not a public spend kind of program. Whereas in the States, there's a fair amount of coverage. So a lot of labs are starting to offer the testing. So more labs that offer the testing, the more need for Sequence2Script. So majority of our market is in the States at this moment. We also have some in Europe as well. But Canada has been difficult for us to enter because labs don't want to offer something that they're not going to get reimbursed for.
Right.
or there's very few people that are willing to pay for it at this point. So, so that's been one of our challenges. Not much we can do about that except for advocate, and that's where my research comes in, is pushing it, saying, look, this is good for Canadians. We need to offer this. Yeah. That's kind of where we're at right now.
Yeah, and I don't think that challenge is unique to you as a innovator in Canada with a health-related product, for sure.
No.
I think that definitely ties back to you. You're saying, you kind of had designed the tool to work with the Alberta data piece, and so it's almost like partnerships, like thinking about potential partnerships as you're, translating that seems so important to you. I think that would be a good takeaway.
And in fact, the partnership that right off the one of the very first partnerships was with Alberta Precision Labs. At the time, it was Calgary Laboratory Services, and then Alberta Public Labs, and now Alberta Precision Labs. But Alberta Precision Labs has been great. That's where we do all of our testing, even for our research. So it's not done in my own lab. The reason was deliberate. This is a research protocol, research project, but if it gets traction and it does get accepted as a standard of care, we wanted to be able to just flip the switch. It's already being done in a clinically certified lab. So I don't have to switch it from my research lab to a clinical lab, which takes months to maybe a year. So we can do that quickly. So we were thinking that way from the start.
Yeah.
Like, let's make this so that we can easily translate into the clinical space as fast as possible.
It seems like it's definitely worked out for you.
So far, yeah. I mean, we still don't have Alberta on board yet, but no province has yet. So it's still early days, but I do think we are on the cusp. Again, 'cause our neighbors to the south are doing it quite a bit. I think it's just a matter of time before we decide that we need to do it as well.
Yeah. I want to talk about risk. So, as we say, like your faculty member, your researcher base, you were like I'm not an entrepreneur, like I can't do this. Like, what really did inspire you to do this, like to continue on? Because you could have just done the NeuroNexus event and had these and be like, oh cool, I did it, I tried it, it's fine, just leave it there. Tell me about it.
Yeah, the NeuroNexus event is what kind of got me start thinking about it more. When I started, it was just like, let's help me develop this solution for our local need. But by the end of it, I was like, wait, this could go a lot farther, right? And so it was. I think what inspired me was more the scope. I seen my scope was just exploding. Instead of just thinking so locally, I was like, well, maybe we should think more globally about this. And that was just reinforced when I started talking to colleagues and speaking at conferences, and people coming up to me and saying, we need this. We want this. So I really never felt like I was taking a risk because it kind of crept up on me. It wasn't like I just jumped in right away, like I'm starting a business. I didn't do it that way. I never felt too risky because the entrepreneurial path I'm on and my academic path are really intertwined. My whole research is on pharmacogenomics, and the entrepreneur path is about pharmacogenomics, so they sometimes are indistinguishable. One, I'm just making money on it, and the one, I'm begging for money. So that's the only difference, really. But they're both really pinging back and forth of each other. What I learn in my research, I try to apply in entrepreneurship, and what I hear from customers, I start to think about research questions as well. So they kind of work back and forth, and I think that really helps. I think it's riskier if you're jumping away from your academic research into something else. But for me, the word risk really never came up to me as much. Again, because I did it slow. I wasn't asking for huge investments, and so I didn't feel that pressure right off the start.
Very interesting. And now, I feel like your journey is very inspiring. So I'm just curious, what advice would you have for other researchers who are, looking at, not necessarily risk or, but they could see a potential of moving, but they're just not sure to take that step. What would you tell them?
Yeah, don't do it alone. And if you're in Calgary, there's no reason to do it alone. Like we just spoke before, there's just so many programs and incubators and all these things. When I started, I wouldn't say I was doing it alone because NeuroNexus was kind of a bit of a starter, but that was just to get the product. From that point forward, I think for probably 6-7 months, I was on my own, and you get into your own head and you start thinking, is this good enough? Should I even do this? It's not perfect. And right away, when you start talking with people at AIR and stuff, perfect's never going to happen. If you wait for perfect, you'll never start a business.
Right.
So they, again, challenging those mindsets. So I think you need to get out of your own head talk with other people, get within the ecosystem, see what other people have done, you immediately start thinking, okay, this isn't this isn't as hard as I thought it was going to be. There's a lot of help around, and I find people generally just really want to help. At least here in Calgary, I felt like there's always someone there like, oh yeah, I can help you out with that. So it's been really helpful.
Excellent. I think that's some great advice.
Yeah.
Don't be alone.
Yeah, don't be alone. There's no need for it.
Excellent. Well, thank you so much, Chad. I really appreciate you taking the time to share your story with us.
Yeah, no problem.
Thanks for coming on Now Innovating.
Yeah, thank you.
You can learn more about Sequence2Script by visiting their website, Sequence2Script.com. To learn how to move your research to impact in the Innovation at UCalgary ecosystem, visit ucalgary.ca/innovation.